How would you handle a language barrier with a patient? This is a common and very important question in pharmacy interviews, especially in diverse communities. The hiring manager wants to assess your communication skills, cultural sensitivity, and problem-solving approach in real-life patient care situations. As a pharmacist, your ability to deliver safe, effective, and person-centered care, even when communication is challenging, is absolutely vital. In this video, we will explain how to approach and answer this interview question, provide a sample response, and walk you through a real-life scenario to back it up. By the end of this video, you'll be able to confidently structure your response, highlight key strengths, and understand what should be avoided when answering this question. The following are guidelines on how to approach this question. Employers ask this question to evaluate how you ensure patient safety, informed consent, and medication adherence despite communication barriers. They want to see if you are resourceful, ethical, and patient-focused. Key skills to demonstrate include problem-solving, effective communication, and cultural competence. Avoid statements like, "I'd just speak slowly," or "I'd assume a family member can help," as these can lead to errors or breach confidentiality. Avoid using untrained interpreters, ignoring the language barrier, or assuming the patient understands just because they nod. Instead, focus on using professional interpretation services, verifying understanding, and tailoring your approach to meet the patient's needs. This ensures clarity, builds trust, and upholds professional standards. Make sure your response covers using available resources such as translated materials, interpreter tools, or multilingual staff, your role in ensuring patient understanding and maintaining confidentiality throughout. If you follow these guidelines, you'll be able to demonstrate both empathy and competence in your answer. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If I encountered a language barrier with a patient, my first step would be to use a professional interpreter, either in person or through a phone or video service, to ensure accurate communication. I'd also make use of any translated leaflets or visual aids available for the medication or condition in question. If no interpreter is immediately available, I would take steps to safely delay the consultation, or provide clear written follow-up with translation support. I'd always check for understanding by asking the patient to explain back in their own words what we discussed. My aim is to make sure the patient feels understood, informed, and empowered to take their medication safely and effectively. Example scenario. I remember when a patient came in speaking very little English, needing help with a newly prescribed anticoagulant. I quickly arranged a phone interpreter through our health board's language service while offering the patient a seat in a private area. Through the interpreter, I explained the importance of adherence, bleeding risks, and monitoring. I also gave them a translated patient information leaflet and asked them to repeat the key points back to me, which they did successfully. The patient later returned to thank us, saying they felt respected and well cared for. In conclusion, handling language barriers with empathy, professionalism, and proper tools not only ensures patient safety but also builds trust in your role as a pharmacist.